We'll draw mammary gland, location and extent. First of all, draw a 7 and its mirror image, and one more small 7 attaching to it, and draw these lines like shoulders covering it, and two parallel lines attaching it. That forms a neck, and you can draw a V-shaped thing that is a sternocleidomastoid mustard. And you can draw a oval-shaped head, and upon it you can draw hairs also. So this is the manogram and the body of the sternum and zipper process. You can draw this as whole sternum, and here you can draw a circle represents the mammary gland, and the center has nipple. So the situation of the breast is it lies in the superficial fascia of the pectoral region. It is extended from second to sixth rib vertically, horizontally from the lateral border of the sternum to the mid-axillary line, and the breast is divided into four quadrants: upper medial, upper lateral, and lower lateral. It is extended vertically from second rib to sixth rib, and horizontal from lateral border of the sternum to the mid-axillary line. Lateral border of the sternum and mid-axillary line. So the extent here we can write is horizontally from lateral border of the sternum to mid-axillary line, and vertically from second rib to sixth rib. In a small extension of the upper lateral quadrant called axillary tail of Spence pass through an opening called as foramen of Langer into the deep fascia and lies in the axilla. So this is the sternum and these are the ribs and extend from vertical and horizontal. You can make her look beautiful by drawing extra hair also. We will discuss structure of breast. The breast lies in the superficial fascia of the pectoral region. If you see the external structure of the breast, it has nipple and areola. This is breast. You can see deep to the breast you can see the rib cage, and here you can see the intercostal muscles. And as we all know, the breast is extended vertically from second to sixth rib, and here the clavicle and subclavius muscle, and beneath that pectoralis minor muscle, and enclosing it clavipectoral fascia, and enclosing these pectoralis minor muscle is the pectoralis major muscle, and it is surrounded by pectoral fascia. And here you can see the characteristic retromammary space. So because of this space only the breast can be movable. So now as we get into the deeper aspect of the structure of the breast, the structure of the breast has three divisions like skin, parenchyma, stroma, and here the parenchyma is the actual mammary gland. So breast and mammary gland are synonymous. Here the skin that covers the gland, it has nipple and areola, and the mammary gland is a compound tubular alveolar gland. It secretes the milk. And stroma is the supporting framework. It has fibrous part and a fatty part. Like fibrous forms the septa and the fatty forms the fat which accumulates around the breast to give it its support. And here the septa are the ligaments that are suspensory ligament of Cooper which holds in position. Here you can see the skin and parenchyma and stroma of the breast. This is the overall structure of the breast. Stay tuned. Hi guys, we'll discuss about structure of breast part 2, that is mammary gland. First of all, draw two lines and draw a C joining them. After that, small C in the middle of that C in contact, so that is the nipple, and besides it, pigmented skin, that's areola. From the nipple, draw the lacteous ducts and lacteous sinus and the lobe, as shown in this. And in the lobes, you can see the intralobular ducts and the lobules, where the acini tissues are present, or alveoli. As you can see here, when you zoom out here, you can see the lobe and the lobules, where the acini clusters of acini will form lobules, which secretes milk into the intralobular duct, and these intralobular ducts will form lactiferous sinus and lactiferous duct, and it will come out from the nipple. This is how the milk produced by the acini will flow through these channels and eject out, which is sucked by the baby. As we have discussed earlier, this is the retromammary space. So behind that is the pectoral fascia and pectoral muscle which is enclosed by this fascia, and we have suspensory ligaments which holds the lobes in position, and you can see the stroma, the fat, which is the most abundant, and this forms the stroma, so you can see the fat which is most abundant. And if you see in breast, there are 15 to 20 lobes, and there are many lobules, and you can see the same number of lactiferous sinus and lactiferous ducts. And so the summary is like draw two lines and C and small c, and you can see the lactiferous ducts, lactiferous sinus and lobes, and the lobules in the lobes, the suspensory ligaments holding the lobes, and the fat which is present.